In this video, we're going to cover on how much does Medicare cost, Medicare Part A premium and Medicare Part B premium. Medicare Part A is usually premium free due to you working at least 40 quarters. You usually don't have to pay a Medicare Part A premium if you or a qualifying person, such as a spouse or a former spouse who have paid into Medicare taxes for 10 years. Now, if you don't qualify for Part A premium free, then you would have a premium. You would have a Medicare premium for Part A if you've contributed less than 10 years or less than 40 quarters into Medicare taxes. If you're between 30 to 39 quarters, then your premium is $278 per month. If you have fewer than 30 quarters, then your monthly premium is $505 per month. Extremely expensive. So yeah, there you have for Medicare Part A premium. Now let's transition into Medicare Part B premium. Medicare's Part B premium in 2024, the standard premium is $174.70 per month. Keep in mind your Medicare premium is always determined by your modified adjusted gross income from 2 years ago. So if in 2022 you've made less than $103,000 as a single, and in 2024 your premium is $174.70. However, if you made more than that, then you could pay a higher premium. It's always based on 2 years ago. So your premium 2025 will be determined based on your income in 2023, as an example. Now, here's a picture, wherever here, I'm going to include the chart from Medicare's website that shows the different income level that you're at, whether you're single or filing taxes jointly, and what your premium will be for 2024. I'll also link the URL down in the video description so that you can be directed to Medicare's website where it shows you all of the Medicare premium information as well. Your standard premium is $174.70. As a couple, you found if you make less than $206,000 as a married couple filing jointly. The most you will pay when it comes to Medicare premium is $594 per month. However, you would have to make more than $500,000 as a single and more than $750,000 filing jointly. Keep in mind, it is important to note that you want to sign up for Medicare Part B if you don't have any other credible coverage, such as a spouse employer coverage or coverage through your employment. Because if you don't, Medicare will assess a late enrollment penalty for when you should have signed up for Medicare but did not. And the penalty, you'll pay an extra 10% in penalty for each year that you should have signed up for Medicare but did not. The penalty is added to your Medicare Part B premium and is assessed lifetime. It is not a one-time late fee. It is a permanent fee as long as you have Medicare Part B. Generally, you won't have to pay a penalty if you have other credible coverage, as I've mentioned before, because this would qualify you for a special enrollment period if you chose to not take on Part B at the age of 65, and let's say you're continuously working till the age of 70 and you did not have Medicare Part B this whole time due to employment coverage. You qualify for something called a special enrollment period where you have active employment coverage. You chose to postpone it. Now, this is one example of how you would not be assessed a late enrollment penalty for your Medicare Part B. So I'm going to give you an example of a Medicare Part B penalty. Let's say you go 2 full years without picking up Medicare Part B, you would be assessed a 20% penalty on your Medicare Part B base premium. In 2024, your premium is $174.70. 2 years without Medicare Part B means that's a 20% penalty, 10% for each year, right? So 20% of $174.70, which would equate to $34.94 per month. So $34.94 plus $174.70 your premium will be $209.64 per month. And that penalty is assessed for as long as you have Medicare Part B. So it is always a good idea to pick up Medicare Part B if you do not have any other coverage, because typically at your age demographic, you are more inclined to utilize healthcare services. Without insurance, it is the quickest way to file for bankruptcy, and we don't want that for you. So there you have it. That's Medicare Part B premium as well. Now let's transition to Medicare Part D premium. Medicare Part D, some insurance company offers plan as low as 50 cents, upwards of $90. It is all dependent on your needs and your ongoing prescriptions as well. We always recommend doing a comparison, but for most individuals that we work with, in their typical Medicare Part D premium only costs, $10 to $30. Usually, it is sufficient coverage for your ongoing medications. Prescription Part D plan premium vary based on the plan that you choose. It is all dependent on the prescriptions that you're currently taking, and that can change on a yearly basis as you review your plan each and every year. As insurance company come out with new plan, upon review, you might find a plan that will provide a better coverage for the updated prescriptions that you're on. So the premium always varies, but from personal experience working with so many clients, usually the monthly premium ranges between $10 to $30 per month. Could be more, could be less. It depends on your situation. Similarly to Medicare Part B, Medicare Part D can assess a late enrollment penalty as well if you choose not to obtain one, but decide to pick one up later when you have a need for it. Might pay a penalty if you first got on Medicare but did not sign up for a Part D plan. You might pay a Part D penalty if you go 63 days or more without credible drug coverage that is a similar coverage to that of Medicare Part D plan. How much is the Medicare Part D penalty? Great question. You'll pay an extra 1% in penalty for each month that you should have had Part D coverage but did not. So for a full year, that will be an equivalent of 12% penalty. Same thing, the penalty is added to your monthly premium. It is not a one-time late fee. It is a permanent penalty so long as you have a prescription drug plan. Some individuals can choose to go on a Medicare Advantage plan without drug coverage because they have TRICARE for life coverage or VA coverage. In those instances, then you can avoid paying Part D penalty. That's one way to go around it as well. If other people don't want to have drug coverage entirely, if that's what they chose to do, you can go on a medical only Medicare Advantage plan that does not administer drug coverage. That way you can avoid the penalty completely. That's another option. Also, if you have credible drug coverage after the age of 65 due to employment coverage, you won't have to pay a Part D penalty. Also, if you qualify for extra help due to living in a low income and have limited resources, you may qualify for extra help, and extra help will pay for those penalty and also majority of your Medicare Part D premium as well. I'll give you an example of a Medicare Part D late enrollment penalty. Let's say you go 14 months without prescription drug coverage. That is an equivalent of 14% of penalty because it's 1% for each month. The penalty amount comes from the National Base Beneficiary Premium amount, and that amount in 2024 is $34.70. 14% of $34.70 would equal $4.86, but it gets rounded, so it becomes $4.90. So that penalty, $4.90 due to 14%, 14 months without drug coverage, will be added to your to your premium, whichever. So whenever you sign up, let's say your Part D plan was $10, $4.90, that'd be $14.90, and that is a permanent premium penalty as well. So there you have it. I hope I kept the video simple enough and straightforward enough. If you like the content, please like and subscribe to support the channel. Thank you so much.